I'm up first. I like it. Okay, so only one resolution. We have a immunization nurse who retired. She's working part-time for us due to with the COVID stuff. She's also hanging in the wings to help train a replacement for her. It's a critical position for us going forward. Seen in the news lately that many parents are foregoing immunizations because they don't want to take their kids to the doctors. With school starting to, actually today we've got some notice of some committees that Hudson School District is forming to try to go bring the kids back in September. I think we're going to be busy late summer with immunizations. And if there is a vaccine for COVID, I suspect that we're going to have a hand in that too. So this, for me, is a very critical position that I fill. Hard to be down. It's hard to be down a nurse with this crisis going on.
Any questions for Jack?
I'll make the motion.
Okay, I'll second it.
All in favor?
Aye. Aye.
So carried.
Just a couple of things from the report, from the director's report. We have nine folks going through rabies exposure. This is a lot for this time of the year. Most of them are bats. Interestingly enough, I don't think I've seen as many people actually being bitten by bats in their homes. I think it's the vet at the state health department says it was about the warm winter and a lot more bats being out there, but the bats are keeping us pretty busy. We are reopening, so we've set a rabies clinic for Germantown for July 25th to help replace the 3 that we lost during the COVID. We're going to keep the other schedules. We have one in Lebanon, one in Cloverwood, one in Kinderhook. Those are normal. We're going to go forward as normal, but this one in July is going to be our first since we had to cancel the other 3. We are looking at setting up a clinic for COVID testing right here at our building on a Sunday, July 12th. We're talking with Ichabod Crane about one on their campus on August 9th. So those are just a few things that are sort of in the works. I'll take any questions.
Questions for Jack?
I have a question, Jack. So a couple of folks have asked me about the count, the positive count. In Germantown, it was 1 number for a while, and then it dropped all the way down to 1. And I just want to get an understanding of the philosophy behind it. That's not just total number of positive cases we ever had. Is that active positive cases that we have?
I think one of the changes that Victoria, who does that, tried to get more refined in terms of the addresses. I'll have to take a look at it if it was that big of a drop for you, but basically what she told me was that she was trying to get to the point where she was actually being able to identify addresses that might be in one town. So we had some Copac and Gallatin early on, whatever. So it was trying to get more refined and get them to a definite town. So I'll take another look at your town in particular, because that seems like a big drop.
Yeah, it went from 8 to 1. So
yeah.
That's good news, but I'd like to know what's behind that.
Yeah, I'll have to take another look at that because that.
Thank you. Appreciate it.
Anyone else? Okay. Thank you, Jack.
Okay, thank you.
Bob?
Thanks, Mr. Chairman. I'll start off with the resolution request. So I'm about a year into my Galvin contract with the Mental Health Association. I think all things considered, it's gone pretty well, given that it was a startup for about 6 months and then COVID hit. So, there's definitely been some bumps, but it's going well. But I'm just going to move around some resources out there. And so that I will actually need one less caseworker from MHA, because I'm going to repurpose one of my caseworkers that I have here over to work directly with that caseworker. So I simply need to amend the contract to reflect that reality. It's actually a bit of a cost savings.
That's good. Any questions? Motion to approve.
Fury will make it.
Second.
Second.
Abdus, all in favor?
Aye.
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 Okay.
And also wanted to add one thing after that, and thank you for that. So one of the things that's developed since the COVID crisis is that I opened a window for the public so that people could walk up to it. And that and putting in a mailbox specific for dropping off papers that you didn't have to have any interaction with folks has greatly enhanced our ability not only to work with the public, but it's helped us keep up on all of our applications. I'm very proud of the fact that we're not behind at all, even though at times we were down to as little as 20% staffing. In any event, I've decided that I'm going to keep that window open for the public going forward. It just makes a lot of sense. A lot of people have been able to get in and get out very quickly. For instance, if it's just to stop by and pay their spend down on a Medicaid case, I mean, they're literally in and out of here in 2 minutes. The worker's already there at the window. So I just wanted to apprise the board of that. I think that it's it's been very fruitful. I'm even going to change the area a little bit. Unless there were some kind of objection, I think I'm probably going to put an awning up outside of there to keep the weather off of the folks. But I think it's an added public service, and barring any objection from any member of this committee, I would like to keep it going indefinitely beyond the public health crisis.
Bob,
I think that's a great idea.
Sorry, go ahead, Barbara.
No, that's all I had to say. I just think it's a great idea to add something as simple as that can make a quantitative difference in people's lives. Thank you.
Bob, I think it's great as well. Are there any safety concerns in reference to, people would not be coming in the building, they would be going directly to a window, is that correct?
They would, and what we've done is, as you know, we have deputies that are stationed here on a full-time basis for all operation hours. They actually assist clients as well. So in other words, there are times when they have to help clients get into the building for whatever reason. There might be, some difficulty because of a disability. They've always been a great help. They've helped direct people during this crisis. Oh, go right around to the window. But they also stationed a deputy right out in that back room where the window is as well. So there's always assistance for the client if they need it, and there's always, if there happens to be any kind of public safety issue, they're right there. So they're both in the lobby now, and they're out by the window.
That's great. Thank you, Bob.
Thank you. And with that, I'll just keep you up to date. But I think that we're going to continue to see this as a plus for people who really need to come in and get out in a hurry, or on a nice day, they really don't want to come into the lobby, and it's nice just to come up to the window and recertify. So I will keep the board apprised of that. And with that, any other questions I'm happy to take, but I have nothing else.
Any other questions?
Yeah, just a question. Is that an extra staff to put another deputy back there, or is that?
It is not. It is not. We've just simply kept one deputy out in the lobby and moved one to the back window. And we've taken, there's usually 2 people manning the reception area desk, but we just moved one out to the window so that everything is manned at the same time. And it's gone very well. I'm going to certainly keep an eye on it and see as the seasons change, does it continue to make sense? As volume goes up, does it continue to make sense? I'll just keep an open mind to that, but it just feels like the reaction to it's been very positive, both from my staff and the public. So that's why I'd like to keep it going and keep looking at it.
Sort of like a bank window, like a bank drive-up window?
Yeah, except you can walk up to this.
Okay.
Hey, Bob, I have a question.
Sure.
How many deputies are in the building? Just curious.
There's at any given time,
Yes.
it's generally 2 full-time that are here from just before the time we open until just after the time we close.
Thanks. And I'm curious what the security issues are at Galvan. Is there a manager or is there additional security people there? I'm just curious how that works.
Well, that's been difficult. Yes, there is a manager there. Yes, we've had somebody dedicated to security and public safety there, and we've had caseworkers there. It's early for me to say it's not worked as well at times as I'd like it to, but again, we had startups early on, and then we had COVID later on, and that kept even some of the caseworkers from being able to come out as often as they would. I'm not sure about Galvin staff. So there's a concern there. Nothing's happened other than me feeling like I get information later than I would like to get it. And that it's not as coordinated through the different staffing people that I'd like it to be. And that's why I'm sort of making the change to plug us in a little bit more carefully. But there's not a police presence out at Galvin so much as there's a presence for public safety, somebody dedicated to everybody in the room, and somebody that they know they can come see if they have any questions or concerns, or somebody who can alert authorities if there is a concern by calling 911 or the like.
And I don't remember, it's been a while, like who is responsible for that manager? Is it you or is it the Galvan Foundation?
So Galvin's got a responsibility to actually have a grounds person that manages the hotel. I took it on in the contract to add to whatever services that were provided, to have such services that would also sort of coincide with public safety, dedicated not just to case work, but is everything all right? Just taking rounds, going around, understanding, hey, we had a problem last night with John in room 17, and we need to keep an eye on that. John doesn't need to go to the ED right now, but will that become a possibility, or did John have somebody in the room he shouldn't have had? That type of thing. That's what I've dedicated.
And that we pay for that. That's our person, right?
That comes out of the MHA. Yes, correct.
Thank you.
Sure.
Any other questions for Bob?
Well, I just wanted to note that the security that's provided down at the Galvin is something that the residents in the area had asked for when we went through this process. So it's not only for security on premise, but it's also security in the surrounding area.
Is the security person on site a contracted security person, or are they using the sheriff's, paying a sheriff's deputy to do it?
No, we put an RFP out, and we've got a contract agent out there. And again, he actually he presents as security. It does say, I think it says staff on some of his paraphernalia and security on others. But this particular person had 20 years as a state trooper, and I really reiterated to that person, it's less a police presence, it's more of a security. Yes, it's for the community at large, absolutely, and it made them feel better. But also it was for the benefit of the clients as well, to make them feel like there's a presence there that's watching out for their well-being, and that it's on the DSS end. It's not just on the hotel operating end.
Yeah, that's what's a little confusing to me. That's who we pay.
Correct.
Thank you.
Yeah.
This is Kathy. I haven't, and since Galvin's been there, I've only had 2 phone calls from the same person regarding where they were walking when they went up to the store. But other than that, I've had no concerns or complaints called to the supervisor's office about the shelter. So that's a good thing.
Yeah, no, I appreciate that, Kathy. And you know, one of the things that I did ask this particular contractor is, you know, to establish relationships in the community, to make sure that they reached out. If there are any issues, we'd like to hear about that. There was an issue with the Liberia school. You know, they had concerns, so I invited them over there. Now, right now, they're closed. I'm not sure if there's a plan to reopen, but they were a big part of, you know, making sure that we had good relations with the school, given the proximity to the Galvin.
I remember.
Yeah, all of those things. But yeah, I think it's important. I understood everybody's concerns, as we said at the time, from the community. So, you know, we're trying to do that. And, you know, quite frankly, I'd like to do a full report and have this committee out at the Galvin, as we've talked about for months. And, you know, COVID sort of put a little bit of a damper on that. But when we can, I'd like to demonstrate it by showing everybody around and introducing everybody so that you can see the facilities and what we are doing and what we hope to accomplish. And, you know, again, COVID's put a damper on it a little bit because there's supposed to be a lot more of the community presence out there. We haven't been able to have people from different agencies be out there and stationed out there as we plan to do, because COVID kind of shut that down. But when we do get back open to, I suppose, phase 4, we should be able to do that. But I'd still like to invite the committee to come out and see that.
Thank you.
Bob, Rick Scalera.
Hey, Rick.
Hey, one quick question. I see on the program that you have 87 homeless individuals in May. And of course, you know, and Galvin, of course, only takes maximum of, I think, 25. Where are the other 62 located?
So they're as they always were, Rick, scattered about. Some are at the Jocelyn, some are out at the Yorkshire, some are at the, I think the Four Seasons, but don't quote me on that. So we do what we can. And sometimes if we get, so when we were up over 100, which we were back in March and April, we were even out of county for a while. So we take them out there, we put them up, and we get them back here when we need to.
Bob, is 87 for this time of year high?
It is. It is for June.
Yeah, I think so too.
Yeah.
And we don't have any way of knowing what the contributing factor to that is, do we?
Unemployment.
No, we're gonna guess. Well, we're gonna guess COVID. Yeah, without being scientific about that. I hope to be able to actually be able to measure that when we get back up. But my best guess is, you know, I've been super cautious with the code blue people and let them stay on a little bit longer. Particularly when we didn't want people out and about in the community. So that certainly contributes to it. Someone said unemployment. I'm certainly not. And COVID contributed to that. But we're higher for June than we would ordinarily be at this time.
Any other questions for Bob? Thank you, Bob.
Thank you, folks.
Health and Medical Services.
Good afternoon, everyone. Good to see you. I hope you're well. I don't have any resolutions. I would normally have personnel resolutions if it weren't for the circumstances we find ourselves in. I do have 3 topics that I wanted to talk about today. The first is our staffing level and my concerns about it. We are now at 11 vacancies We're also down a net of 7 hours a week for contracted prescribers. Our census has remained stable at the clinic and within our care coordination programs. The clinic has a growing wait list, and a suggestion was made either last week meeting or the meeting before last, for us to reach out to the hospital to see if they could take some of our clients on the waiting list. And we did, and they cannot. And we know that commercial private practitioners are not generally taking commercial cases either. So we've got a lot of people out there in a crisis with symptoms and interest in getting treatment who have no access to treatment. That's especially concerning for our clinic because we're the only licensed clinic, OMH licensed clinic in Columbia County. We do the best we can. The vacancy freeze impact and the furloughs have really impacted us significantly, and it is a growing concern for me as our vacancies, as we get into the furloughs, and we will shortly have vacation requests. We got somebody going out on a maternity leave. So it's a real concern of mine how we're going to keep up with very demanding and fragile clients, kids and adults. So if there is any latitude that you can give me for 2 of the positions of the 11 that I'm down, I would be greatly appreciative. One of the recommendations I'd like to consider to be able, given the latitude to do, is to temporarily close our Valatia Medical Arts site to the public as furloughs exist and the position vacancies increase. We're finding it harder and harder to staff both sites in all the in all the ways that we need to provide coverage. So I would make that request that I be given that latitude to, on a temporary basis, close our Valatia Medical Arts site to the public. We still probably would have 1 or 2 staff working there to reduce density in Hudson, but the coverage we need to handle the public in that building, we can't sustain.
Can you tell us how many people are served at that location and what it would mean, and who is typically served there?
Well, right now, no one's being served there. We are 100% telehealth, and that is exclusively so in Valatia. We have a very small portion of our Hudson census who receive injectable medication, and they receive face-to-face services in Hudson, but we are not serving anyone currently in Valatia and aren't projected to serve anyone there anytime soon. The clients that normally would have come there, you know, I don't know off the top of my head, about 50 individuals come there routinely. They're being served by telehealth, so I'm not concerned on that level of the clinical impact to closing that site temporarily.
So it really wouldn't be a closure as much as it would be an extension of telemedicine or telehealth.
Well, I'm respectful and aware of the directive that I was given to make sure that our sites were open to the public. And we have done that. But I'm just proposing that our site in Valatia be considered to be temporarily closed to the public to allow us to, among many other methods, to allow us to try to accommodate this drastic reduction in staffing.
Michael, this would be a temporary thing potentially. I mean, especially if we, if things aren't as bad and funding comes back slightly, this could be reopened if need be. But telehealth is working, so these clients are getting service, correct?
Yes, this would be, yes, it is most definitely working. It's, there's problems with it, but it is definitely working to the extent that we're continue to be permitted to get reimbursed for those services. We would suggest that it's advisable for us to primarily offer telehealth services for the foreseeable future. We have a 5-year lease at VMA. We're not going anywhere. And so this is very much temporary, and we want to have that site in, to have it reopened as soon as possible. But we need personnel to do that. Right now, we don't have the personnel, and we have another way of meeting the clinical need.
Matt?
Can I suggest maybe that we close it till September and revisit it, get through the summer, and then we can talk about it again as a committee?
Right now, I'm asking for the latitude to do that. So if you can give me the latitude, if we need to close until September, I'd appreciate it.
I would support that, Michael. I think as the clients are getting serviced, it's not like we're shutting down the service to the clients, which is important. I think that would be a reasonable request that we should think about. Does anybody from the committee have any other thoughts?
So I'm just confused. Is the staff going to be there? I'm confused. Is the staff there and they're not going to be there and everybody's gone? Or it's very confusing what you're asking about. I'm just confused.
The request is to temporarily close to the public.
I get that, excuse me, but you've already said that the public doesn't go there.
They haven't gone there since March 20th, right? Correct.
So that's what's confusing.
Well, what the June 5th directive from Chairman Morrell indicated was that the departments were required to have their sites open to the public as of the 15th of June. So we have done that. We are accessible to the public right now.
But you'd like to go back to post-COVID, or I guess during COVID, as to how you've been operating it, correct? Which is that you weren't open to the public.
On a temporary basis if we need to until September.
Yeah.
If I could clarify, the intent of the memo was for county office buildings. The thought of a satellite didn't enter my mind at that time, but it makes sense for you to want to be able to, close access to the public at this time.
Okay.
Any other questions? Any other concerns, thoughts?
So Rob, what form of approval does it take for Michael to get his latitude?
At this point, I think the committee would just approve that and continue on as he was before the June 15th directive. Correct, Matt?
Correct.
Yeah.
Somebody can make a motion, and
Right.
it doesn't need to be a resolution, but
Make a motion that Michael has the latitude to either open or close, at least until September, where we will revisit it. Correct?
Correct.
Second.
Second.
All in favor?
Aye.
Opposed? So carried. This sort of leads us into the next topic, which is school satellite update, which Michael will discuss, but I just wanted to let the committee know that I did meet with Michael through a Zoom meeting with Dan Amasi and who else was on the meeting, Michael?
Jennifer Samuels, a senior psychiatric social worker that oversees the children's clinic staff who staff the school satellites. So for those of you who don't know, approximately 10 years ago, our licensed OMH clinics started developing on-site mental health clinic satellites in the school districts. We started with John L. Edwards in Hudson, and I think the next one was Taconic Hills. In any case, we are now, or prior to COVID, we were in all 6 districts. That certainly had its advantages, and I think was well intended. And the financial model was intended to be temporary and to be reviewed at a later date. The financial model going into it was we would attempt to cover our costs through insurance reimbursement. That has not been entirely successful. We recover about half of our costs, and probably 6 months ago, 9 months ago, I forget, I wrote a letter to the superintendents of each district and proposed a shared financing plan for future on-site clinic satellites in their districts. And I have either not heard back from the superintendents, or I heard back from one saying that they were not able to respond to that request. So basically, we are on our own financially to support these school satellite services. And as much as it pains me to do so, I think for a variety of reasons, mostly financial at this point, I would recommend that we not continue offering on-site services at least while we're in this hiring freeze, and potentially beyond that if schools are not willing to contribute financially to this cost of a very valuable service.
Just for my clarification, is this in addition, I'm assuming this is totally separate from a guidance counselor. This is mental health counseling.
Yes, this is mental health counseling.
And how many students approximately take advantage of this annually?
Well, you know, it's on paper, it's very few, and part of that is represents what the problem is. Our OMH restrictions, our regulations, our requirements that we have to meet in order to make a service billable really reduce the number of kids that we can formally have on our census. We may serve many other kids because the school has asked us to, and they're, you know, the kid's in a crisis or the family needs support, but they're not technically on our census. So the actual numbers of kids enrolled, admitted to our clinic that are served on those sites is relatively low. And that's part of the problem, that we would like the latitude to be able to serve other kids without having to admit them to the clinic. But in order to do that, we need a replacement for the insurance reimbursement.
And the schools do have their own social workers. Some schools are bringing on additional ones this year. I don't know how many specifically each school district has, but there are social workers at the schools. So we were offering an additional service. The consensus of the group when we met was, again, to give them the latitude not to do that. And we've had to make a decision. This has sort of been dragging on, nobody's fault, but we're into June. I think even Supervisor Berry was going to get involved a little bit further back, but then when COVID hit, we sort of didn't do anything in reference to from the schools. So that's sort of where we're at. I think Michael, given his situation, it would be very difficult to try to continue on this program.
Chairman, as you had said, we were looking, the productivity committee was looking at the whole school satellite issue as well as other issues. And we were, you know, prepared to approach the schools again with a funding partnership, which actually Supervisor Bury was working on. But like you said, when COVID hit, that sort of all went south. I think probably it's a good time because of us not knowing where we are financially and the schools not knowing where they are financially, that we hit a reset button, take a step back, you know, see where we are at the end of this pandemic, and, you know, maybe, you know, move forward everybody's ready to move forward, including schools.
I like that. Maybe we could frame it as a suspension. You know, just temporarily, we're not going to offer that service, and we'll revisit it once the dust settles.
You know, we do have potentially things could not be as bad as we are anticipating. I mean, we don't know that, but things are moving rather quickly through the phases. Tomorrow we're into phase 3. So we don't know. I mean, we all hope things rebound quicker than what we were anticipating. But I think to give you the latitude now, Michael, and to support that would take a little bit of weight off your shoulders. And I support that. I don't know what the rest of the committee feels.
I have a question. It's Kathy.
Go ahead, Kathy.
Were there clinicians at each school?
Yes.
Yes.
Not full time, you know, part time at each school. Some, like Hudson, had some hours in each of the sites within the district. Other districts had just selected sites. But yeah,
So
we
will this
had.
help by closing these like the schools? Will this help you with your, with your productivity to see the people that you say aren't being seen, aren't being able to be seen? Will that change?
No, it won't, unfortunately. We've had to absorb so many losses of staff that really won't make a dent. And it's not like we didn't pick up serving those kids that we were serving in the school. We continued to serve them. We just served them primarily out of our Hudson site, to some extent out of our Valatia site. Now, this financial issue predated COVID, the COVID financial issue. We were running at a deficit for quite some time, and we're contemplating whether this is a model that was sustainable given our department's overall deficit.
I understand the need to be fiscally responsible, but everything I read suggests that kids are very anxious and very stressed, much more than usual. And I wonder how that's going to be after a summer of no sports and no activities and, a much longer physical separation from school. I mean, they will have had instead of a 3-month summer vacation, they'll have had a 6-month, at least out of the school. So it just feels a little counterintuitive to me to take away a service which may have a much greater need than it has had historically.
I disagree.
I would agree. It is counterintuitive, and it couldn't be a worse time to withdraw and contract services. On the other hand, this is an extraordinary time, and this has been brewing for years, that it's got to be sustainable. And the other issue is that we are serving the kids, and we will continue to serve the kids and families. We just can't serve them on site in the way that we were.
Mm-hmm.
And to be honest, we don't even know if school's going to be able to open in September.
Oh, there's that too.
That's true.
Yeah.
I think we're school to start, and I think several districts, or it's certainly more than one district, is talking about the fact that maybe it'll be half days in order to manage the social distancing aspects. That all sounds very stressful on the staff and on the parents and on the kids. And I guess, Michael, what I'm concerned about, I hear you say that you'll continue to serve those people, but if we have a waiting list that you're already concerned about, and we're no longer in the community, I can only see this waiting list getting longer and longer. I don't know if we really would be serving those people, those students. And I apologize. I don't have an alternative to suggest. It just, this to me asks more questions than it answers.
As I said in the beginning, it pains me to propose this because I agree with you. This is a very difficult time to constrict services.
Any other questions for Michael? Any more discussion on this topic? Do we want to make a similar motion as we did for Vallecia Medical Arts in reference to, pausing this now, as Matt said, and then revisiting this in the fall?
I'll move that.
I'll second it.
All in favor?
Yuri.
Aye.
Aye.
Opposed?
Opposed.
Brenda, opposed?
Brenda opposed.
So carried. Thank you, Michael.
I would like to ask Supervisor Lagonia if you could, if I could send you a draft of a letter that I would like to send to the superintendents informing them of this development. If you could look that over before I send it out.
Absolutely. Matt, do we have to, I had asked the question, do we have to do any more than what the committee, Michael had asked me, and I think we just sort of didn't answer that question.
I don't think so, but I can ask Rob Fitzsimmons if we have to do something formally through a resolution.
Get me the letter and I'll look at it. I'll run it by Matt and Rob as well, and then we can get that right out. Okay.
Michael, are these relationships defined by contracts?
There's a memorandum of understanding with each of the districts, a 1-year MOU.
And when is that typically renewed?
It gets renewed now, essentially.
Okay.
Goes school calendar year to school calendar year.
Thank you.
The last thing I just wanted to alert everyone to, I mentioned several meetings ago that the state, even before COVID-19, announced that all local governmental units, and that we call that the LGU, are going to be cut in a category of state aid funding called LGU administration. For us, the percentage cut is equivalent to about $15,000 a year. We can absorb that, but it is one of 2 cuts that we were informed of a couple of months ago. This is pre-COVID-19. The other one had to do with 100% funding of competency evaluations in state facilities, which is a much more costly county expense potentially. I just wanted to let you know about it, that we have adjusted the budget with Ron's help. I don't think we need a resolution for it, but you let me know.
No, Mike, this is Ron. I don't think we need a resolution. PJ and I already planned on these cuts, and when we came up projecting revenue losses, this was part of it. So we're all set.
Thank you, Ryan.
Update.
Any other questions for Michael? Anything else, Michael?
I'm all set.
Thank you very much. We appreciate that. Anything else, Kelly? That's it, right?
That was it.
Anything else the committee wants to bring up? If not, I'll take a motion to adjourn.
So we will take it.
Second.
Or else second.